Like it's thinking. And it looks like we are live. Welcome, everybody. So glad to see everyone here. Trying to see if we can get this going on YouTube. It looks like there's people waiting. Mine says live, but why are we not on YouTube? Very interesting. Oh, there we go. All right. See, so I started talking and mine didn't refresh, so I apologize if I was just randomly talking over everybody here. My name is Dr. Tom Moorcroft. I'm so excited to be hanging out with you guys for this May 2021 for Lyme Awareness Month, joined by my good friend, Dr. Alexis Chesney. And the reason that I wanted to have a conversation with her today is she's the author of an amazing book called Preventing Lyme and Other Tick-Borne Diseases. And in there, she talks a lot about control of ticks, a lot of our landscape things we can do around our house and our yard, preventing tick bites on ourselves and our animals, and then also what to do if we get tick bites. This is an invaluable resource, including information on how to protect your yard, information on medications, herbal treatments. So, and Dr. Chesney also has a private practice. She runs a tick bite clinic, is on the board of ILADS, and in her copious spare time, she hangs out with me on YouTube. So, Dr. Chesney, Alexis, welcome.
Hi, Dr. Moorcroft. So good to be here. Thank you for having me.
Yeah, you're very welcome. And thanks for taking time out to really be talking with us about all these important things in May. It's like we were just talking how the weather's changing. It's getting a little warmer, a lot of places, at least in the U.S. So what are you seeing this time of year with your patients, and what kind of questions are out there that we might want to start off by sharing with everybody so that they kind of get a lay of the land and know what to expect this time of year?
Yeah, well, the tick bite calls are coming in, even just patients that I'm usually seeing for complex chronic illness or tick-borne disease, or having follow-ups, and they're like, oh, I had another tick bite, just today. I had somebody come in with multiple tick bites in the last couple weeks. So they're out there, and I can't, tell people enough about prevention so that we can hopefully end this epidemic through prevention. And for those who are already suffering with Lyme and tick-borne disease, we certainly don't need to get additional tick-borne diseases. So I'm talking a lot about prevention, treating tick bites so that we can really get to anything early if any pathogens were transmitted. So talking about this a lot lately. Yeah.
Right. Yeah. And it's like so great. It's great. Everybody's like, hey, I'm ready to go outside in the woods and everything, go play in the yard. But darn, can I go outside? And I think that's a big question for folks is, with all this Lyme and co-infections, can we actually even go outside anymore? Is it safe, or is there a way at least to make it safer?
Yeah, I know. Some people are really scared. I have patients that tell me they're terrified to go outside, and it's so sad, right?
Right.
And I go outside. I want us to enjoy this beautiful place that we live in, but I take a lot of precautions. I don't just go running through the tall grass. And maybe that decreases my spontaneity, but I go on hikes, I go on bike rides. I'll have a picnic outside with a nice permethrin treated blanket underneath me. I take a lot of precautions, and it's just become habit now, so it doesn't feel as difficult. But I think, just like brushing my teeth, there are different habits that we need to take when we live in places like this. Like I'm in southern New England and Vermont/New Hampshire. And so,
right.
We really need to think about this day in and day out, especially when it's so beautiful out right now and the ticks are out.
Right. So where's the place to start, though? Do you start the conversation in your yard and your surrounding area? Do you start it with personal prevention? Where do we kind of dive into this whole thing?
Yeah, well, I'll ask people about what are they doing already, right? Because some people are doing some things, which is great, and get to know, their habits. So do they have a yard? Do they have horses? Do they have dogs?
Right.
Pets that are bringing in ticks. Are they a logger or a farmer, right? So there are all these ways that we can be exposed. But yeah, so for instance, with the yard, thinking about different ways in which ticks, live.
Right.
They love moisture. So, just kind of applying that principle. They're going to be in dark areas, shaded areas, leaf litter, where the humidity is. They need the humidity to live. So the dryness, if it's a windy area on the top of a hill, maybe there are going to be less ticks there. But if it's, under some brush in a darker forest, or a meadow that's got lots of vegetation and humidity, then there might be more ticks there. So thinking about that in people's property or yard, and then thinking about things like tick tubes. I love tick tubes, and
Right.
I've seen really great things over the years, hearing from patients from one year to the next how they may have gone outside just to barbecue or enjoy some time outside, and come in with ticks all the time, and now they're not seeing that. So it really makes a big difference.
Right. So tell us more about the tick tubes, because I'm sure some of the people watching have heard about these or seen these, but and the different ways that you can kind of go about either making them or getting them.
Yeah, so you can make them your own. You can make it a school project, right, with all the homeschooling that was going on and remote schooling, or just do it with your family. And you can save paper towel tubes and toilet tissue tubes, and save some lint from the dryer, get some cotton balls. And then you go outside, put gloves on, use permethrin, right? Be careful with permethrin, because when it is wet, it is toxic to our skin. So you want to be careful with that. You spray down the lint or the cotton balls. You let it dry over about 1 to 2 hours, depending. And then you can stuff that material into the tubes and put that out in mouse habitat. And then the mice bring that material back to their nests. And so it's the permethrin on the cotton or lint that actually will kill the ticks on these mice. And we want to target the mouse population, because that's usually where the larvae, the first stage of the tick, will get infected with Lyme. So, really interrupting the cycle right there, because, there are 3 stages of tick: larvae, nymph, and adult. And it's usually the later stages, the nymphs and the adults, that will come after the bigger humans, whereas the larvae will attach to somebody really small, close to the ground, like a mouse. And then that's where they can acquire tick-borne diseases. So targeting that population is excellent. And we see that using tick tubes decreases the risk of getting tick bites by 93%, which is pretty amazing.
Yeah, and it's interesting. I was just pulling it up. If anybody grabs Alexis's book, it's actually literally, I saw this earlier when we were talking, pages 72 and 73, how to make your own.
Yeah.
And it's great because, there are a lot of commercial things, like in Connecticut and some of the surrounding states. We have a place called Connecticut Tick Control, and it's, called Nix Ticks. And they use a system where they have something where it's like a commercially made, essentially, tick tube in a box that they charge a lot more for, and then they spray a couple times a year during those high areas or high times of the year. But I think it's really important that the research I've seen with the Bayer system is like literally within 2 years, you're down like 98% reduction in your tick population. And that's what you've been seeing as well.
Yeah, absolutely.
It's great. I think it's so, guys, this is like, we're literally able to bring down the infectivity rates of the ticks and the tick population on your property just by these really simple things to do. Now, what are other things that we might want to think about in our yard? Because one of the things I like to remind people of is that Lyme disease is considered paradomestic, meaning about 75% of people are going to get Lyme in their yard or their neighbor's yard. So what else do we do in our yard besides put some tick traps? And I realize that, like, when I have them do my lawn and they keep the leaves in the woods behind us, maybe not the best idea. Pay a couple more bucks to get those hauled off. But what do we do in the yard?
Yeah. So, there are some essential oil sprays. So you mentioned some companies. I wonder if they also do the essential oil sprays. So some people have had good luck with those. You do need to do it maybe 2 or 3 times a year to really see a difference. It's called IC3. That was the latest in my research with some local pest control companies. So instead of using something like, a pesticide, you could use the essential oils that are gentler on, certain, fish or bumblebees and things that we might want to keep around, right, and target the ticks. So that's important. Also thinking about, just cleaning up the yard, right? Some basic things like cleaning up the leaves and being really careful when you do it. Not leaving, branches and different debris around. And then thinking about the change from something like grass to the woods. That's where ticks love to be as well. So also avoiding certain areas, or just being really educated on this, so that you can, if you need to go into certain spaces, that you're wearing tick repellents or whatnot.
So that area is called the edge, right? That 10 feet from the lawn to the edge of the woods or whatever, and then the 10 feet into the woods. So there are really high risk areas.
Yes. Yeah, exactly.
Cool. So then one of the things I see a lot of people do is they put their like swing set in the back corner in the shade.
Yes. Right. So not doing that. Yeah. And bird feeders, right? So thinking about how birds carry ticks, and maybe not putting that right outside the window, although I know that's sad, but putting that more in the perimeter, or just removing them, really, when we're thinking about this.
Right.
Yeah. Swing sets, like sandboxes, thinking about where the kids are playing. That's really important.
So, and what are we thinking about for ourselves? Because I mean, if we kind of modify the yard to be a little more dry, maybe get the swing set into the sun, stay a little bit more away from the edge. But what if we have to go into the woods, or we're going to be hiking around a meadow or going to play? Like, what should we be doing on our clothes, on ourselves?
Yeah, great. So permethrin, again, is wonderful to use on the clothing. Again, if you're treating your materials yourself, just be careful wearing gloves and letting it dry before you put it on. But actually, by treating socks and shoes, it cuts down on the risk of tick bites by 72 times, which is incredible, right? So if we just even focus on socks and shoes, you can buy some awesome permethrin treated socks. I have a bunch of them from Insect Shield. They're a great company. So insectshield.com. You can buy clothes from them too. Or you can send clothes to them and have them treated, which I've also done, which is great.
Yeah, that is killer, because you told me that tip last year, and I was just like, guys, shove that bag full.
Yeah. It's like 1 fee to crush everything in that bag, right?
Yeah. And so we grab like the Sawyer spray and stuff that you can get at the local like hardware store or sports store, that has like fishing outfitters or Cabela's or something, or even on Amazon. But it's great. Like, one of the things, like I in the past would feel kind of guilty because our daughter is like going to camp, and I'm like, oh, I forgot to do the clothes, but like I always did the shoes and the socks, right? And it really does make a massive difference.
Yeah, it's incredible. And it's easy. I put it on the calendar myself. I get all the shoes, the sneakers, the boots out every 6 weeks, because when you do it yourself, it does lose its efficacy after 6 weeks. But when you can't send your shoes out. So, but if you send your clothes out, it'll last 70 washes.
That's insane.
Commercially done. Which is great, because that's a longer, amount of time. But for the shoes, I just put them on, it doesn't take that long. I just put it on my calendar and go out, and on a weekend, spray them down, leave them on the deck, let them dry, and I feel a lot safer,
I've seen it work, because we still go outside and do all kinds of things. But I mean, it's made a massive difference, and it's simple. I mean, here it is, shoes and socks. One of the other tips I got asked to do an article for Men's Health about how do you keep ticks off of your nether parts, because they had to have a cool headline, and stuff. But what's really interesting is, one of the things that I've also found that I love to share with people is, I have people wear like compression shorts or compression shirts that basically make like a barrier. Because like you were saying earlier, Alexis, is they love dark, warm, moist places. Well, your groin and your armpits are great ones. And now I always warn people, you don't have to do like the sports compression ones that are like so hard to get on and like you're dying. But like Under Armour and other companies have like kind of like the designer almost compression ones. So they're kind of cool to wear, but they're not truly compressed. Those are perfect because they seal around there. And you could even treat those with permethrin as well.
Sure,
right?
Absolutely. I love that. That's a
occlusive barrier, right? And it's kind of nice in the summer. I mean, just because I will admit, I'm being a bad doctor, but I love wearing shorts in the summer. So I'm like, spray the shoes and the socks or wear the flip-flops, but wear that barrier.
Yeah, that's great. And then also, using repellents like cedar side. I love cedar side, cedar essential oil. Yep. And that's a spray that's safe for your skin, right? So you could spray it on your head, you can spray it on your legs and your arms.
And you spray it on your pets, right?
And on your pet, over 20 pounds. Yep.
Cool.
You can do that. Yeah. So
yeah, it's great. It's funny because I just think about it. It's like I used to use another company, Honey Birch Farm, had a bug and tick spray that I saw worked really well. Only issue is they don't make it anymore. But we used to like spray it on our dogs. And it's interesting because I would even get it like just on their legs and their underside and not worry about a lot of the rest. And then I would distract them right away so that they wouldn't be licking it off or anything. But it's safe stuff. And it works. That's the thing that gets me is like, and when you look at like things like DEET, I don't see DEET working as well as some of these essential oil based type of repellents. And to me, like if you ever took a plastic Band-Aid and sprayed DEET on it, and then you wait a second, and then you rub it with your face, it'll literally take all the plastic of the Band-Aid away.
Oh.
So I'm like, I don't want that on my skin.
Wow, I know, right? Yeah. Wow.
But other thoughts or tricks kind of like for our for ourselves, our bodies to keep these kind of things away?
Well, 6 for ticks. When you come in, do a tick check and then put your clothes in the dryer for 6 minutes on high. So you can think 6 for ticks. So, I mean, obviously tick checks are really important. I think a combination of all that we're talking about today is going to be more effective than just one thing. And some people do, kind of a casual tick check, right? So it's important to really get in there, like you're saying.
And then they call us the next day.
No. Right. They're like, oh, I kind of looked, but yeah, I didn't really look at my back. And but getting in all those hard to reach areas and looking in the mirror, asking, getting your family together and checking each other, things like that. But then put the clothes in the dryer. So like we were saying, ticks do not like dryness. It desiccates them, it kills them. So one thing that might not be intuitive is to put the clothes, if they're dirty, right into the dryer. But just keep in mind, if you do put them in the wash first, they're going to survive unless it's very, very hot water. So then they're loving the water, they're surviving, then they're crawling around your washer, which isn't so great. And then you're putting them in the dryer and then it takes 55 minutes for them to die. So, if you can just go right for the dryer, 6 minutes, doesn't take long.
And that's not going to ruin your clothes. I mean, that's not enough to lock all that in. And the thing is too, like a lot of it is, maybe you have to have outdoor clothes, especially if you're treating them with the permethrin and everything. But I mean, think about the alternative, right?
Yeah. No, and that, I've gotten feedback on that from patients and, some people brought that into their practice and really see that makes a big difference too. They'll find the dead ticks in the dryer, better than an embedded tick or an engorged tick next to you in bed. After the fact, right?
Well, and another thing I do is I do all those things, but I hop right in the shower when I come in. I make it a point if I've been outside, I don't know that it doesn't replace my tick check, but I'm just like, if they're walking around my body looking for a place to bite and they haven't bitten me yet, then why not give them a shot to get washed down my drain, and get a tick check?
Absolutely. Yeah, and you're in the shower, so it's a good time to do a tick check. So that's good. It's a good combo.
Awesome. So do the tick check, 6 for ticks in the dryer, take our shower. What are Do you have any, I mean, tick checks are a pain in the rear end, I think. I mean, I think a lot of us, at least we have that mindset that's true, and maybe it's not. But do you have any like guidance for patients that could just kind of like, hey, how do you get into this routine and make it maybe less cumbersome and boring than just having so that they can actually be more effective at it?
Like sing a song while you're doing it, something like that. Do a dance, lighten it up a little bit. I mean, I think also sometimes, we might have limitations in our mobility or something, and that can be difficult. So using a mirror, you may need to do something like that, or, ask someone to help you out. And also not just sight, but feeling like I know the moles on my body. It's
right.
Like you kind of get used to the texture of your skin and like, okay, that wasn't there before. That one was, but something like that. To use all of our senses.
Right. Well, and the other thing too, everyone, I would also suggest you use one of these things. Because what I found is that, not that I'm that old or anything, but sometimes my vision after a long day, especially after in COVID with all the computer time, I've seen my vision's a little off at the end of the day. You can actually zoom in on really small stuff really easily. And if you're by yourself, you have limited mobility, you could actually use your phone and the video capability, especially the newer ones. I mean, it's like, I don't even know why I bought a video camera. And you can really use them to your advantage. And I was going to joke about it a minute ago, and then I'm thinking about it. It might be a good thing. You could do Zoom tick checks with your friends if you had to,
You could. That's so true, right?
I mean, all this stuff that used to be taboo, like showing my armpit to my friend on Zoom, So, well, that's great. I mean, I think it's good. Like we've talked about some ways that we can work on our yard and where we can position ourselves in the high risk areas for ticks. And then also about some of the ways that we can maybe, prevent tick bites at the moment. And then I really want to talk about what happens if we get bitten by a tick. But Mary had a really cool question that popped up a little while ago, and we just kept talking. So I wanted to make sure we get to it. Because I love these things. And so she asked, what happens to the cat that might eat that infected mouse?
Ah, yes. People ask this all the time. I don't remember the exact amount, but I finally located a study at some point, and the cat would have to ingest such a large amount of permethrin. It was just ridiculous. I just felt reassured that wouldn't happen.
Right.
And certainly that's not the amount of permethrin that's in any of these tick tubes. So it feels okay.
Yeah, and then so to me, like the permethrin too, when you look at Sawyer's, it's like 0.5%, which is the one you can buy to administer yourself and spray on things. And when you look at like scabies treatment for people, now it's in a lotion, it's a slightly different stabilized formula, but that's a 5% that we would put directly on our skin. The biggest thing that I actually got into medicine accidentally through all my outdoor activities, and I was a natural resources wildlife biology person. And the biggest thing with permethrin is getting it into the water supply. So if you are doing work with this, because if you put it in you're going to knock out some aquatic plants and murder pretty much all the fish that are right by where you dump your permethrin. So let's try to keep it out of there. So if you're doing it like at a campsite and stuff, where you're out in the woods and stuff, just, for freshen up at the end of the day, just move yourself a little bit away from the water supply so you don't accidentally dump it in there. The other question though, so the cat's not going to get sick from chowing on a mouse that had some, the permethrin on it. Right. Especially if it's dry, which it should be at that point.
Right, exactly, yes.
Now the other question I have is, I mean, cats don't really seem to get Lyme like dogs and people do. But I mean, I know this is kind of an offbeat question, but what the heck, that's how I go. Like, what do you think? I mean, is a cat at risk for getting infected this way?
I always thought it was really interesting that we don't hear about cats getting Lyme. And why is that? And couldn't we figure that out and use that for treatment in some way or something?
Oh, it's like that fence lizard and stuff in California they were looking at years and years and years ago, and I didn't hear anything come of it. But they were like, hey, the lizard doesn't get Lyme. I'm like, oh, okay.
Right, yeah. I remember that, yeah.
So I guess we'll have to get back to everybody on that one once we figure out, I mean, heck, if we can figure that one out, we're going to do a great service for the whole planet, man. Yeah, and so this is the part that I find. I mean, prevention is always key, but as we know, these are little buggers. I mean, if you think about it, everybody, if you look at a poppy seed, or that is the size of the nymph tick that really is 95% of people are getting Lyme from the nymph, and because it's a no-see-um. So, I mean, think about a poppy seed on your body. So the big thing here is, what do we do if we get bitten by a tick? Because I know that, like, there's research that came out of Brown last year that said, hey, by the end of 2020, we're going to have 1.9 million people with post-treatment Lyme syndrome. And when you look at post-treatment Lyme syndrome and chronic Lyme disease, nobody's doing a good job differentiating those. And I believe that post-treatment Lyme syndrome they've discovered is a real thing. And I would suggest most of those people have chronic Lyme. So how do we go about preventing that? I mean, we already have 2 million people with this crap. And to me, everyone, this is the most important part of the whole conversation. You've done everything you can do to prevent it, but now you got bitten by a tick. What do you think, Dr. Chesney?
Yeah. So I recommend taking some steps after a tick bite for sure. So first, of course, remove it as soon as possible. I recommend using the Otom tick twister.
Well, it just so happens that some kind friend of mine sent me this tick preparedness kit. So let me see if I can find an Otom in here, because I bet you it is.
Okay. Look at that.
I kept it to open it here.
I have one around here too.
Here you go. There we go. I'll take it out because these are super cool.
Yeah, I just, when I first started treating Lyme, and
big one and a little one. See if I can zoom in. Oh yeah, it actually is working.
Very nice.
I've got my hands backwards, so I've got one in focus and one I have no idea where it is. Yep. So anyway, this is what these guys look like. And how do we use these things?
Yeah, so you just slide it right under the tick, right on your skin. Yeah, and then you just twist and pull. You got to twist.
Oh, this one twists?
Twist and pull. Go twisting and pull. Yeah.
Cool.
And it's really that easy. I mean, occasionally it takes 2 tries, but it's pretty amazing. Tweezers in the beginning of my practice, I would just mutilate these ticks. It was so frustrating, and the patient's nervous, and then I'm nervous. We're mutilating the tick. It's just not pleasant. I'm thinking about the tick regurgitating back into the person under that stress. So this is just nice, simple. It gets the mouth parts out too, clean and easy. And then what I do is I put andrographis on the bite afterwards.
Got some of that in my kit.
Look at that.
I was psyched. I was like, man, you got everything in this kit.
Yeah, I'm so excited. They just came out not that long ago. So I described this in the book, and I want people to be prepared with this first aid kit.
I mean, think about it. Look how small. Like I'll still use needle tip tweezers, but this is so easy. And the big thing, everyone, is we want to focus on the mouth parts, because they have like barbs on the mouth part that really bites you. And we want to kind of give them a chance. So if you're using the tweezers, you got to grab them close and just lift and hold. And if you're using this fancy thing, you slide it in, get as close as you can, do a little twist and lift, and like Dr. Chesney said, 1 or 2 shots and it should work. But I think you brought up a really good point, Alexis, is we don't want to be pissing off these ticks. And so can you dive into a little bit of what's going on in their biology that makes us not want to irritate them when we're removing them?
Yeah, so before they attach, hopefully most of the time, the Borrelia burgdorferi, or whatever the pathogen is going to be in the midgut and not in the salivary glands yet. So these pathogens need to move up to the salivary glands so it can move out through the saliva into you or into its host at some point. And so when, before they're attached, we don't know how long this takes. That's part of the mystery of this big question of, well, how long does it take for a tick to transmit Lyme disease, right? But that's what we're thinking about is, when it's attaching, then that movement of the pathogen, we want to get it out as soon as possible. And if we're agitating it, it might actually regurgitate from the salivary glands into you. Like people have done things like, burning the tick using a match, or using petroleum jelly and having it, back out and all this.
Massaging them with essential oils. There's some crazy ideas out there.
Oh my gosh.
I love it.
That's a good one.
I'm just like, people are like, I rub it back and forth. I'm like, oh, I see how you got Lyme. I'm sorry.
Right. Massage the Lyme out of it.
Right. Well, I think it's crazy. I mean, these things that, I just think of it as jet propulsion. If you piss it off, it wants to get out. And the easiest way to do that is to vom, and let's not do that. One quick piece before you tell us more about how we should be treating a tick bite. There's this kind of discussion of how long does a tick need to be attached to you before you actually could get Lyme. And I was hoping you could comment a little bit on that.
Right, I know, and there's such an argument over it. And there are a lot of studies on it, and it could be anywhere from 4 hours to 72 hours. So I think it's important to acknowledge that that, not that I haven't come across a study that looked at sooner than 4 hours, right? So like, what about that amount of time? And so there's a bell curve. So maybe it happens more often later on in 24, 36 hours, but it can happen sooner than that. Plus, we've got ticks out there. About 10% of ticks have already started to feed. And what we were talking about earlier about the movement of the pathogens from the gut to the salivary glands, this might have already happened. I mean, it did already happen if it's feeding. So then for whatever reason, a tick might have attached to one host, got interrupted, and now it is primed and ready to transmit, unfortunately. Now, this is only 10% of the ticks. But when we're thinking about all this math about, just how many cases of Lyme are out there, obviously some of these ticks are getting to people and transmitting Lyme faster. And so it was, I have to remember the number. I think it was 80 to 100% transmitted within 24 hours. That was it for that tick that had already attached to someone else, and now it's attaching to partially fed.
Well, and all these numbers that we get, they're not studying like partial feeding, refeeding. They're just doing sterile tick, infect the tick. Oh, here you go, and you just, it's all in a research lab where we're trying to just find out basic information. And to my read, we've never established the minimum attachment time for a tick bite to lead to Lyme or the transmission of Lyme.
And there are other pathogens, right? So Powassan virus takes, 15 seconds. It can take as little as 15 seconds.
That's great.
I mean, thank goodness it's rare, right? That's scary.
Right. Well, and anaplasma I know has been confirmed at around 8 hours. I mean, so, it's interesting. Yeah. So we know we don't want to be bitten, and we've talked about that. If we do get bitten, we're going to take our OTOM and remove it. We're also going to maybe put some andrographis topically. What's our next step? We've got this tick. What do we do with it?
Yeah, so I would get it tested. So that's a lot of good information. Well, first, if you have the book, it can help you out to identify the tick. So, depending on where you are located, the main issue in Vermont is the black-legged deer tick that is carrying pathogens. But depending on where you are, if you're traveling somewhere and get a tick bite, it's going to be important to know what kind of tick that is, because then you will know which pathogens it might be carrying. Right. And then which symptoms to look out for. But you can also just send the tick off and get it tested. Maybe it comes back and it's not carrying any pathogens. What a relief. That's always a relief. Right. Or if it is carrying something, then that does not mean it was definitely transmitted to you. It's important to notice that, right? But then okay, well, yes, this tick was carrying Lyme. I should watch out for Lyme symptoms over the next 30 days. And you could take some prophylaxis. Well, that's an awesome topic to jump into in 1 second. One of the questions I'm sure people are going to be asking is, where do I send my tick? Yes. So especially since one of the places in New England closed. Well, it's UMass. It's open again. It's
Oh, they are?
you know about that? Yeah, yeah.
No.
I know. I was emailing back and forth because they're my go-to. I was like, what happened? Because they were on furlough multiple times since the
Oh, because
pandemic. So it's all up and running for, I don't know, 2 weeks or something. So
.com.
tickreport.com, the address, the physical address that you send the tick has either changed or will change. So just make note of that.
Right.
But it's the same website. So that's great. Yeah.
Awesome. That's really cool. And then I've also used in the interim, people have used like ticklab.org and everything from the, Pennsylvania Tick Research Lab and stuff. I don't have a lot of experience because it was mostly over the winter, but people have good feedback. And I know there's some other companies that'll do it. Some of the sort of Lyme specialty labs. I think the big thing is Tick Report and some of these other labs, they're going to give you results in 24, 48 hours from receiving it. And, to me, prophylactic antibiotics or herbals or homeopathics, whatever you choose to use, should be started within 5 days of the bite. The sooner, the better. So what do you do? Say I have my little bag that you gave me and I got my tick and it's in the mail. Are you typically, if it's a deer tick too, because dog ticks and Lone Star ticks and Gulf Coast ticks, kind of a whole another ball game. But here in New England, a lot of deer ticks out. I guess if you're in upstate New York, you're also going to have to fend off a lot of Lone Star ticks. And certainly we see dog ticks. But my experience has been deer ticks carry the most number of pathogens and are much more commonly infected than these other ticks. So let's focus on that to share some information about it. But what do you do? I mean, do you just routinely prophylax a deer tick bite? How do you feel about that?
Yeah, I think if somebody comes in without symptoms but wants to be proactive, I recommend doing prophylaxis. So I'll recommend the deer tick bite formula that I formulated over the years, thinking about all of the...
I just happen to have gotten this in the mail.
Just had
nothing to do with us doing this tonight either. It was hilarious. I love it.
So it has cat's claw, knotweed, cryptolepis, and houtunia. And so I was thinking about all these herbs, and I love that recently that research came out about cryptolepis treating babesia, which we know it does, but it's great to have research, right?
Well, we thought it did. Now we know it does, right? This is what's great. Cryptolepis for Lyme, Bartonella, Babesia duncani. Right. I mean, growing forms, non-growing forms. I mean, it's like more broad spectrum than any of our antibiotics for sure.
Yeah, it's pretty amazing. So anyway, so I was thinking about all the different pathogens that the deer tick carries, right? And then of course, herbs do more than just killing. So it's going to help your immune system. Like Japanese knotweed is just so amazing, from when the saliva of the tick, the saliva has proteins that affect our immune system and kind of turns off our immune system in certain ways that lets Lyme come in and get hold, right? So Japanese knotweed actually affects some of these different cytokine cascades, inflammatory issues that come up as a result. So it gives you a lot more support in your immune system, the ability to do well in the face of Lyme, in addition to, outwardly killing it. So that's the formula that I put together. So if somebody doesn't have any symptoms, but it's right after tick bite, it's probably too soon to have symptoms, you can get started on this. So, I would definitely do that. Some people want to take the watch and wait approach, and that's okay too. Of course, right? And then if you get any symptoms, immediately to give me a call, if they're my patient, call your provider, and you could definitely do the deer tick bite formula and even do that with doxycycline or whatever pharmaceutical antibiotics that might be appropriate for those symptoms or that particular tick-borne disease that's going on.
Right.
So I do 30 days, if there are no symptoms and no symptoms come up throughout that experience, just a 30-day treatment.
Yeah, I remember when I got started, it was like, hey, everybody gets doxycycline for 4 to 6 weeks, and if they're asymptomatic, we're good to go. or they get a negative tick back, and then I got to say, hey, I know it's negative, but keep going for another 4 days so I don't cause more trouble than I've already than you had before. But one of the things I've seen is that so many more people are erring on the side of using the herbals because they are sort of multitaskers. They're doing the immune support, they're decreasing inflammation, and they're also killing. And what we're finding from all the research out of Johns Hopkins and Dr. Zhang's lab, and if you guys haven't seen all that research, definitely look at Hopkins over the last 15 months for Lyme, Bartonella, and Babesia duncani and their herbal work. It's just, it's unbelievable. I mean, they found Cryptolepis is stronger than doxycycline for Bartonella. I mean, it's like, it's good stuff. But I'm seeing that a lot more people want to do it. And, the tick bite formula is awesome, but we haven't had it before. So the comment I wanted to make is that, many physicians will do this slightly differently with different herbals, but I've seen it be ultra effective, at least as effective as antibiotics. So that's pretty, I just think it's just really promising. So you don't have to, run over to Lymecore and grab the tick bite formula. But one of the things I'm going to do is start giving it to people ahead of time. Say, hey, if you think you got bit, you got this at home. Give us a call. But if it happens to be, you pull it off the back of your ear at midnight, don't wait for me. Get started, and then go from there. So what else do we do? You said 30 days in the tick bite formula, and I know in your book you mentioned some other ways that people can use other formulas for kids and the weights. So anybody who wants to kind of refer back, just go grab Preventing Lyme. And Dr. Chesney's got all kinds of stuff laid out for you. Other things that we should be doing after a tick bite, other than sending it and starting the deer tick bite
symptoms. I also talk about homeopathic remedies. So that's great to have on hand as well. That's my hope that, and patients have done this over time, that you have all this at home. Hopefully you're not going to get a tick bite, but if you do, then you can just get started and not have to wait to go to the store or call your doctor, et cetera. So at least with these pieces, you could get started. So you could start Ledum. Ledum is used for bites, bite wounds. So
I got mine.
If homeopathic, those little pellets. So you do 3 pellets under your tongue 3 times a day for 3 days. And then if the wound was a little red or itchy, a little swollen, then you could add Apis in addition to the Ledum. You could take them all together. Same thing, 3 pellets under your tongue 3 times a day for 3 days. Of course, if you have what's looking like an erythema migrans, the bullseye rash, or not always a bullseye, right? But if there's a rash, yes, take a picture and send it to your doctor. But if it's any, Lyme rash, I think is important to tell people that, it has to be more than 2 inches in diameter. And that just helps people kind of think about the size, because I get a lot of calls, there's like a tiny little ring around the bite itself. And that's just, that's
the local swelling.
Under a quarter of an inch, that's just this local irritation. And so you could take the Apis if you had an erythema migrans, but of course, please seek out further help on that. And
right, because the Apis isn't going to be treating Lyme, is what you're saying.
Exactly.
It's going to help you locally. The other thing, too, to point out, everybody, is that rash, your EM rash. Well, first of all erythema migrans rash is that classic rash of Lyme. Only about 20, maybe 30% of those are actually bullseyes. So if you have a bullseye, it is a slam dunk. But if you just have a red blotch or a purple blotch, that could be an erythema migrans. That's a call. Go to the clinic, see your provider, or at least take pictures and send it to them so you know. And the other part to remember is that after your bite, you may see that rash expands. If it stops at really, really small, it's probably more that local irritation. But, in medicine, we say, it's got to be 5 centimeters to be a true EM. I'm like, but no EM starts at 5 centimeters. It starts small and it grows, right? So just kind of, be aware of that. This is a great one. There's a question about, and I'm going to try to bite my tongue, but I'll let you put your foot in. This is just a great one. Bob's got a great question about the 2 pills of doxycycline 1 time as prevention.
Yes. Well, so that study, right? There was one study done that this is based on, and it's just so very flawed. They're only studying erythema migrans, and
As a
the
surrogate for Lyme
population.
disease, right?
Right. Right.
Despite the CDC saying 30% of people don't get an EM rash, and the medical literature saying 40 to 60% of people don't get an EM rash. Not to mention all the clinical experience that shows it's even less than that. But all right.
No,
I don't have any
please,
opinions.
no. No, I love it. I love it. And then, yeah, so you've got that. It didn't even, which is kind of crazy, because an erythema migrans is going to disappear eventually, right? That on its own, if it's untreated, if somebody did not get treatment, just part of how Lyme affects the skin is you're going to have that expansive rash, and then it's going to go back and disappear. That doesn't mean Lyme has disappeared. It means that Lyme is systemic at that point without treatment. So that was also, right? It wasn't that one of the ways that they showed, it disappeared, which it does.
Well, right.
Anyhow.
And they removed people they had like 3 seronegative Lyme people. They also had somebody who had an EM rash that was removed from the study for some reason that was because it got Lyme. I'm like, you can't do that, right? I mean, it's just craziness. But it's underpowered, and I mean, it's just tough because if you think about it, it's the only almost well done study, and the problem is we're saying, hey, do 200 milligrams of doxycycline, you're good. The problem is you can blunt the antibody response, which you can blunt the rash maybe. So that means our 2 major kind of no-brainer diagnoses that are clues to us and our physicians that we have Lyme, they're gone. And then, in mouse studies, they did single dose of doxycycline and for Lyme disease, and it was 43% effective, and when you look at, they did studies of doxycycline, a single dose for preventing Lyme and anaplasma. So the tick had two infections, and they found it was 20% effective for Lyme, down from 43%, and only 30% effective for anaplasmosis. Whereas when we look at the mouse studies for long-acting doxycycline of 19 days in duration, it's 100% effective for single Lyme or Lyme and anaplasma. So I don't know, all the evidence we have suggests that maybe we don't want to be doing it that way.
Yeah.
So great question, Bob. So cool. We've got all those things. I mean, I just think it's so important to get on top of this early. I mean, I don't know. What's the hesitation? I mean, have you heard from other docs what the hesitation is to prophylactically treat someone either with medications or with herbs, or is it just kind of what we're trained, or?
Yeah, I don't know. I mean, I also hear all sorts of things when people come to me, maybe after seeing their regular doctor. Some people will give a week or 2 weeks. It's just so funny because usually there's just the standard of care. You're looking up to date or whatever it is, looking at CDC guidelines, IDSA, and it's still just all over the place. Some people clearly don't feel comfortable with the one-time dose. I have people come to me where the doctor said, well, I should take at least a week. I'm like, all right, well, that's interesting. So I think there's, hopefully some questioning going on, sometimes even in the regular medical community. But yeah, I really hope that it can change. And I don't know what the holdup is, but
right. I'd love to see more science, because we're joking around about the study and everything, but the bottom line really is people are doing the research, but we need more research, and that's what I've been really, as a provider in this field, I've been really kind of feeling great in the last 18 months because we have so much more research coming out of Tulane and Johns Hopkins. We've got some big places doing some research. And even, I joke a little about post-treatment Lyme disease syndrome. And what we found, though, through people researching it is it's a real thing. There's real symptoms. But if you follow the normal lab testing protocol, which most of us have read is flawed, and it is, but At least that's what the science shows. When you look on the other side of it, though, people are finding there's actually something really going on and looking deeper. So maybe the research isn't happening, directly in the way we all want, but 5 years ago, we didn't have all of this. So there are really people out there doing their best for all of you and all of us, So it feels good in that, we're moving in a direction, I think that's good.
Yeah, absolutely. No, it's great.
So what do we do? What do you do? Person got a tick bite, you started prophylactic herbs or whatever, and it comes back negative.
So yeah, we could just stop. I mean, that would be fine. So you said the tick was tested and it was negative, right?
Yeah, completely negative.
Yeah. So no symptoms.
No, nothing.
Yeah. So
then
you could
the
at
other
least
question
start
is,
it, and then it's like a relief. Okay, just put it on the shelf. Hopefully you never need it again, but if you do, it's there,
Right. The other question, though, which is the more is like, what happens if somebody, develops symptoms or their tick comes back positive? I mean, how do you look at those scenarios kind of moving forward?
When the tick is positive?
Yeah. Well, let's break it down into two things. Let's say the tick is positive, but they're asymptomatic. What is your kind of general course or approach? Obviously, just for everyone to know, I mean, this is all individualized. You should be working with your practitioner for your specifics, but just from a kind of a general educational perspective, I mean, what are you doing if it's positive, but the person's asymptomatic?
Yeah, so it's always up to them, and some people want to do the prophylactic formula. And so we'll do the deer tick bite formula for 30 days, or if we have the specific information, I might specialize the treatment. Like if it's just Lyme, I might use herbs that I'm really targeting Lyme for, whether or not it was transmitted to them. We have that conversation.
Yeah.
You could either watch and wait for the Lyme symptoms, and maybe they will never happen because it wasn't transmitted to you. We don't know. Or you could take this formula and and also report any symptoms if they come. Yeah.
So that's like the best case scenario. We get bitten by the tick with the infection. We have no symptoms. We do our 30 days or so and we're good to go. What's the transition point? What happens if somebody's on prophylaxis and they start to have some symptoms? Maybe some fatigue comes in or some joint pain. I mean, is there like just a little bit that you tolerate, or do you? What's your thought process at that point?
If it's clear, no. Sometimes there's some obvious. I mean, nowadays with COVID, nothing's obvious, right? But they might develop a fever, new joint or muscle pains, new headaches. Flu-like symptoms, something new and different like that, and then I'll add an antibiotic usually at that point, if they'd like to do that. And so then, we're really moving into a different category. Now we're in the acute tick-borne disease category, opposed to the asymptomatic watch and wait approach, do some prophylaxis if you want to. Now we have symptoms. So I'm going to be thinking about, okay, well, which disease is this? Of course, Lyme is the most common, but is it anaplasmosis? Is there a high fever and the worst headache of your life? Then that's a little more, I'm thinking a little more about anaplasmosis. Right. And, doxycycline is the only thing that treats that. So that's going to be really important. I mean, I work with a lot of people who are outdoors a lot. And so sometimes, we decide not to do doxycycline because of that sun sensitivity for Lyme at certain times of year. So we might do something like cefuroxime. But if I'm thinking anaplasma, or at least I want to, be in communication with the patient about their specific symptoms, because we want to use the doxycycline for 2 weeks, at least for anaplasma, which responds really well. And you can test anaplasma. Whereas with Lyme, you need to wait 4 weeks after the bite or the onset of symptoms to test and get an accurate result, which is a whole nother story. Which test to use? Anyway, putting that on hold. For anaplasma, you can get a PCR the first week of symptoms, and it's going to be an accurate result. So, often that disease brings people to the emergency room. That's often when I'll hear from the patient a week later afterwards, and they're like, all right, what else should I do? I'm on doxycycline. I don't feel like I'm dying anymore, because it's often pretty. But I think it's really important to talk about anaplasmosis. In Vermont, it's we're number one for number of cases in the United States. I don't know what Connecticut is offhand, but I'm sure all the Northeast, we're pretty high for
Right.
anaplasmosis. So
Well, I think it's
there's
also
there's Lyme,
it's
Babesia,
important to know what ticks are active in your area. And it's also important to know what's in those ticks. So, and University of Rhode Island has tickencounter.org that you can see what's kind of more active and what's in those ticks. Better yet, share that link, that reference with your provider, because a lot of people are like, oh, that's not in our area. And then you look and it really is. And I mean, like you said earlier, we've got birds that are flying around, dropping ticks places that maybe they weren't before, but they're there now. And it's great. The other thing, though, as you're talking about anaplasmosis, I just want to remind everybody to bring up Borrelia miyamotoi. I mean, this is a Lyme-like spirochetal infection that's in the relapsing fever group. And in the literature, it's been misdiagnosed as anaplasma and babesiosis. If you misdiagnose it as anaplasma, at least you'll probably be on the right treatment. If you're misdiagnosing it as babesiosis, maybe not so much. But it's really common in the same ticks that have Lyme. And typically in the studies, we see that ticks with Borrelia miyamotoi also have Lyme disease at a higher percentage too. So you're more likely to get infected with both. But that might be why you look like you have anaplasma and babesia and Lyme. Maybe you just got Borrelia miyamotoi. And it's just another one that a lot of people don't check for. Quest now offers antibody testing as well as PCR is available at a lot of our local labs. Some of our specialty labs offer specialty testing as well. But the Quest one's pretty darn good for at least that particular infection. But just to be aware that there's more, like we've been talking about, there's more than one thing in the tick. And if your symptoms look like more than one thing, it could actually be that tick was co-infected and you got more than one thing, not that like we have to go looking for some brand new, different diagnosis. So, boy, this is a lot of great information, Alexis. I love it.
Yeah, well, thank you. I'm learning from you too. I love all the statistics you're rattling off.
Well, yeah, as everybody may know, I'm doing a practitioner certification, so I'm like making sure that I've got it all dialed in for everybody to make sure, because the goal here is to help bring awareness to the practitioner population of what they should be aware of and what their patients are exposed to and themselves are exposed to, so that they can better help people prevent it and to treat it if you get acute Lyme or you get chronic Lyme. Our goal is to prevent as much chronic Lyme as possible. But like even tonight, I mean, getting this information out to the public and keeping it available for people to be able to say, hey, I have a lot of control over this. It might not be as danger-free as I'd like, but I mean, you have a lot of control. And that's what I love. Again, everybody, make sure you check out Dr. Chesney's book here, because it's like, I remember, I think I did a Facebook Live way back in the day. I was just like, oh my God, this book is amazing. Like when I first got it. And it dives into all the things that we've talked about in much greater detail, but also tells you a lot about the other ticks, the herbs you can use for other ticks, the antibiotics you can use for other ticks. Buy it as a gift for your doctor if you want to. I mean, but it's great. So I just want to say thank you for spending all the time here. I know we said we were going to probably be like 40, 45 minutes. We're going way longer because we get in it. But it kind of in wrapping it all up, I mean, the thing I always like to ask people at the end of a conversation is, what are like some key take-home points that kind of summarize, what you want people to know? And then the last little piece is, in Lyme, I mean, everything seems to be so like doom and gloom. I mean, like, I always love to share some hope, because as many people may know, I've had chronic Lyme and babesiosis. I've been after 13 years symptom-free for more than a decade. I know it's possible to heal, but what's your experience and what kind of, healing wisdom and positivity can you share?
Well, I think, like you were saying, having that control, we do have that. I want people to feel empowered. I want you to have this information so that there's less fear out there, that we can enjoy the outdoors and feel like, you're taking some of these recommendations, you're maybe spraying down the sneakers and socks and, you might have your tick kit there, be able to identify a tick if you find one, and so I just hope you can bring some of this home to, your habits of everyday living, so that, you can live with a little more ease and enjoy the outdoors. And I always see that, self-care is such a huge part of healing. So maybe to bridge a little bit to that chronic illness piece, because most of the people I work with have chronic Lyme and tick-borne disease and et cetera. Right. And I just see that, this is kind of an extension of that, right? Really taking care of ourselves and knowing that we can educate ourselves in these ways, just like all the other things, like taking that Epsom salt bath, or, asking for help from our family or our friends or at work, or, getting more sleep and eating well, all these little pieces, and bringing joy into your life. And if walking out on a really nice dirt path without grass is going to bring you joy, please do, right? It's so important.
Yeah, with your whole body plastic suit on, right? I love it because, the thing to me is like, there's these little things you can do every day to take back a huge amount of control of your health, and you just make it a habit, and I love how you use that word too, because it seems hard in the beginning, but then you just take these small steps and move forward. It makes a massive difference. And when it becomes a habit, which is, 66 days, you can do anything for 66 days. Do your tick checks and be comfortable, spray the clothes. The cool part about the spraying your clothes down, like you said, you just put it in your calendar and it alarms for you. You don't even have to remember, which I love. It's automate a lot of this, And just go out and enjoy yourself. I mean, if I had never gone back out in the woods, my life would have been over, I think. Right? I got Lyme in the woods because I love teaching kids about the woods, and I keep going back. But now I've learned all this stuff,
Yeah. And if it's overwhelming, just to take one thing, right? And we implement one thing. I mean, we've both been doing this for a long time. So maybe I've got all these things down, but, even making an impact with one new habit is going to make a difference.
Tell you what, wasn't there a book, the One Thing? Because we all try to do many things. If you chose one thing, like if you decided I was going to drink 3 of these a day, and that's the only thing you focused on for the whole day, other than peeing, pooping, and going to work and eating, you'd be done it. And in a couple of weeks or a couple of months, it'd be your habit. And same thing with all this prevention. So words of amazing wisdom. So everyone, I love to say thanks to Dr. Alexis Chesney for all the work she's doing, for patients everywhere, getting this information out. Check out her book, Preventing Lyme and Other Tick-Borne Diseases. Again, it's that one. And check her out over at Lyme Core Botanicals too, because they've got her Deer Tick Bite formula and a whole bunch of other cool stuff. And it looks like, I don't know if this actually... I had to take the plastic off so people could see it, but we've got the whole tick preparedness kit. And I'll tell you, it's so important. I can't, I just want to say thank you from the bottom of my heart for making this available to patients, because I know we were talking before we came on. It's so hard sometimes for people to get in and to see you or me or people like us in a timely manner. And so now you guys have access to things that you might not have otherwise. Really well done, referenced, naturopathic and conventional medical information in that book. And now we have the tools to treat it at home. So just want to say thanks.
Oh, thank you so much. I love talking to you. It's so wonderful whenever we do this. And I'm looking forward to those Zoom tick checks.
There you go. I think I think we need to trademark that stuff quick.
Right.
Cool. All right, everybody. Thanks so much. Thanks for spending the time on your Tuesday evening. Happy May and springtime going into summer. Enjoy yourself outside. Rewind and watch this a couple of times so you get all the information, and anything we might have missed, pick up the book and check it out there. We'll see you next time.
Bye-bye.